government has condemned the prevention of access to healthcare services at Kalafong Hospital. This is in Atteridgeville in Pretoria. It comes after intimidation by Operation Dudula members at that hospital gate, where they block dark-skinned patients and staff from entering the facility. In some instances, they ask people to speak a South African language to confirm that they are not foreigners. Well, let's get more of what exactly is going on at Kalafong Hospital. We speak now to the CEO of that hospital, Dr Sello Matjila, who talks to us from Atteridgeville. Doc, good morning to you, and help us understand the situation as it holds right now outside your hospital. This apparently has been going on, well, at least the Operation Dudula members have been stationed at your hospital gate for at least the past 3 weeks. Is that still ongoing?
So good morning, Trolly, and good morning to the viewers. Let me just paint the situation at the moment outside our hospital. Yes, indeed, the group is still here, but I can also confirm that we have public order policing services. They are also here with their vans this morning, but the group is still here. But obviously, there's no intimidation or impeding access today for either patient or staff, and I think it's because of the presence of SAPS.
And when did the police arrive at this situation, Doctor? Because, as I say, the reports suggest that the members of Operation Dudula have been stationed there for the past 3 weeks.
So initially, before we secured a court interdict, which we secured on Friday, the police would come in and help, as in when we required their assistance. But then the request was that let's have a court interdict, and so that the police can then be able to enforce it. And this morning the police were here, I think from as early as 6 o'clock with their bikes. So we are comfortable as the hospital, even though the hospital operations have not been disturbed at all. What we do inside the hospital, but the reality of having to deal with a group of protesters lurking around or outside the hospital has been troubling for staff, and I'm sure the patients who want to access the hospital.
Yeah. Confirm, Doctor, if what has been reported is indeed factual, and that is that a barrage of questions is asked of dark-skinned people. What kind of questions are we talking about here, and does that extend to your hospital staff? And if so, how badly has this affected your operations?
So those are the reports that we are getting. So what we then decided as a hospital was that since this is sort of outside our control, that we could not get any closer to the protesters. But indeed, there's been reports, and there's also been, we've also observed that there's some intimidation going on. We then advise our staff to not forget their staff identity cards at home, so that then they are not subjected to an inconvenience when they're coming through into the hospital. But as I stated before, the hospital operations have not been disturbed. It's I would even be saying, you could even invite people to just, for them to understand that we are working and we are making a call to our patients so that they understand that the hospital is running. We are focusing on providing the quality healthcare services to our patients, and people must not be afraid. And at least we have the assurance of the police now that they are here, and they will then manage the situation that is outside the hospital.
CEO, are you aware of reports of a particular patient who, I suppose the group outside would have assumed is a foreign national, and it turns out that she was actually from Limpopo, but she was turned away and she needed help? Are you aware of this patient?
So, and those are the reports that we read on the newspaper, and they also got us very concerned, and we've actually made sure that the police are also aware of those reports as well. But we have not witnessed how the protesters are carrying on with what they are doing outside. So there's been reports about patients being sent back and all that. So as a hospital, we are also troubled, and we're trying to find out, especially where, there were some medical interventions that were denied. We also tried, because we also wrote to the Office of the Health Standard Compliance, by the way, making them aware of what we're going through as the hospital, because there may be a whole lot of complaints that would arise out of patients being denied access. But this is something that is beyond our control.
How long has it taken the police to intervene in this matter? As you paint the situation today, slightly more relaxed, people not questioned, simply because you have public order police at your gate? So,
look, the police have been coming through even before we secured an interdict. But even on Monday, they were here, but they were not staying on. And we hope that they will then understand that they have to be based here until the situation is sort of under control.
Yeah. I'm going to avoid asking you political questions here, CEO, because that's not your forte. But an international NGO called Doctors Without Borders, I'm sure you'll be familiar with them, they have characterized what's happening at your hospital and perhaps in other areas that we may not be aware of as, quote-unquote, xenophobia that's intensifying across South Africa's health facilities. Would you agree with that characterization?
Look, I think what is happening is unfortunate. And I think as patriotic South Africans, we should seize an opportunity to have a meaningful discussion around this issue that is all bothering us. And I think I'll just leave it at that. But it is very troubling. I think for this to be going on in this manner.
Have you had calls from those above you? I'm talking about the provincial government. I'm aware of the efforts that they've taken. They've gone to court to seek an interdict, which was obtained. What about national government? Have the people there been in touch with you? And what kinds of interventions are being thought of right now?
So we've been taking guidance from our principals, both from the province and nationally. And I think at the moment they've sort of taken over. I think to an extent that once we have, they've even issued statements, by the way. And I think at the moment, at least everybody understands that the hospital operations have not been disturbed. We've been working. And I'm sure they will then take over from here because this thing is of national importance. So we'll probably start seeing a whole lot of action from their side.
Yeah.
Because I think we've dealt with just ensuring that everybody understands that we have the situation that we have in our hands, like just outside the hospital. But then again, also that the operations have not been disturbed.
Yeah. I'll ask you this final question, Doctor, and I'm not going to ask you for, I think, specific figures, but are you seeing a lot of foreign nationals seeking help at your hospital? And if so, how inundated are you by these patients? And is that a resources drainer, would you say?
So, look, I mean, there's quite a substantive number. I think I think it's a national problem. But I can also say that as a hospital, I mean, the majority of our patients are South African citizens. I don't have the stats off the top of my head, but obviously, if you see those people that you haven't necessarily, the budget has not considered the size of the population that you see, the resources would actually take a strain. And I think that's where we are, not only as the hospital, I think even as the province, like you've had, even with the Limpopo case as well. But this is the reality of what we're going through.
Yeah. All right, Doctor, as I let you go, do hospitals who come to your hospital or who come to your facility, are they asked to pay money? And I ask you this because you are a government facility.
Yeah, so we classify, we have what we call uniform patient fee schedule. So we do a means test when you come through, and we then would make you pay according to the affordability that was determined after that means test was done. Obviously, if you can't pay at that moment, then we make you acknowledge the debt, and then we have to then follow up.
Dr. Sello Matjila, let me thank you very much for your time and your honest response to these questions, CEO of the Kalafong Tertiary Hospital.